More than 29 million Americans have experienced depression, and the drugs available to treat them haven't changed much in the last 25 years. Well, Dr. John LaPook tells us that two studies out today focus on a new class of drugs that may offer new hope.
I tried to commit suicide, and it wasn't a hearty attempt. It was just screaming out for help.
58-year-old Jim Staples has suffered from depression since his 20s.
What's the feeling that you have inside when you get to the point where you actually want to hurt yourself?
Scared. Scared because I don't want to hurt my family.
From your 20s until now, what has been the arc of your illness?
The medicines that I had been taking over the years, they only worked for 2 to 3 years, and then they just fizzled out.
In depressed patients such as Jim Staples, brain cell communication breaks down. Current medications target a chemical called serotonin to help brain cells talk to each other, but it's present in just 5% of those cells. These new drugs target a different chemical called glutamate, present in 80% of brain cells. Researchers believe these new drugs restore the lost communication better than older drugs, which can take months to kick in. Dr. Gerard Sanacora of Yale University is leading one of the trials.
The exciting part of some of these newer medications is that they might, in fact, produce very rapid antidepressant effects within hours or days.
This new approach was discovered by accident when doctors noticed that an anesthesia drug, ketamine, that targets glutamate relieved depression. But it also caused symptoms that mimicked schizophrenia. Dr. Ron Birch has been developing Glix-13, one of these new medications.
What we found is Glix-13 has a very nice antidepressant effect, very rapid occurring, lasts for several days after a single dose, and with no side effects of schizophrenia at all.
In one study, patients taking an experimental drug had a 40% improvement in symptoms compared to 24% on placebo. Jim Staples participated in the trial.
My hope is that the trial drug will, in time, be the last one I'll ever have to take. I'd take the drug for the rest of my life, but it'll be the last one I have to switch to.
The drugs are still in trials, and even if they continue to show promise, FDA approval is still 3 to 5 years away.
Thanks, Doc.